Well, for today's event, we have Dr. Alexander Borsand. Is the current president of the Arizona Hyperbaric Society, certified trainer for the International Board of Undersea Medicine, faculty for the International Hyperbaric Association, and medical advisor to the National Hyperbaric Safety Association. As the owner and operator of RX-O2 Hyperbaric Clinic, Dr. Borsand believes in utilizing oxygen under pressure to provide a foundation for healing to his patients and raising awareness of the field of hyperbaric medicine. So please welcome Dr. Borsand.
Thank you so much. Thank you, thank you. I really appreciate being invited here today, and I just absolutely love to share about hyperbaric medicine. You know, that was a great introduction. Thank you so much. You know, a little bit about myself. Yes, I do hyperbaric and nothing else. Our clinics don't provide anything except for oxygen. So, as she mentioned, you know, a little bit of introduction here. Just a little bit about myself. So she did mention here that I do own hyperbaric clinics, and I'm on a couple of the different boards. So my initial board certification is in preventative and lifestyle medicine, and I can think of nothing else that fits the mold better than hyperbaric oxygen therapy. In fact, in my education, I went to the naturopath medical school as well. I'm not a naturopath, but I wanted to better understand those naturopathic principles, and I'm willing to bet most of the people here probably have seen or are seeing a naturopath and had much better results than with maybe my boards, the allopathic medicine. I apologize for them. But, but so the reason I'm part of the Arizona Naturopathic Medical Association here is because we believe that what we do is a naturopathic, or at least fits those naturopathic properties. So a couple of the boards I'm associated with, and one of the things they mentioned was that all about increasing access and awareness to what we do here. We love people to learn about what oxygen can do. Our clinics are right here in the valley. However, most of our patients live in other states, and otherwise we want to make sure everybody leaves here knowing more about what hyperbaric can do and take it back to their community. So moving forward here, my presentation is called Younger Next Year. Turns out there's a book called that as well. I might have had that on my bookshelf and had it in the back of my mind when I came up with this title, so apologies for stepping on anybody's feet there. But Younger Next Year, really? Well, hyperbaric medicine does play a role in reducing your biological age. As we look at what biological age is, we're talking about your DNA. We're talking about protecting your DNA. So this measure of your DNA is done by looking at your telomeres. And telomeres have become a very popular topic recently. Most people are doing something to promote their DNA health at this point. Maybe you're doing fasting. You know, maybe you're doing red light therapy. Maybe you're using exosomes, which Dr. Yu will talk about. And I got to tell you, he is my personal exosome doctor. I love Dr. Yu. I cannot wait for you to hear what he has to say. His energy is just fantastic. But as we talk about biological age, it's a much better indication of health than your chronological age. Everybody here has their chronological age every year. It gets a little bit older, but does your biological age have to get older every year? And the answer is an unequivocal no. And when I had my telomeres tested recently, they tested much younger than what I currently am. I'm not celebrating that birthday this year. I'll still be celebrating my chronological age, but I love to see what we can do. So Younger Next Year, really, no, we're not going to look younger. What we do is not the aesthetic part. And we talk about anti-aging. We're here in Scottsdale, and people have some different views on what anti-aging is here in Scottsdale. And I got to say, there's a big disagreement there. So as we talk about what is hyperbaric oxygen therapy, I like people to understand from the get-go, from what we do, from the medical standpoint, from the wellness standpoint, every aspect of hyperbaric. So let's get a little deep into this. I do get a little deep into the science, and I know we've got a very short period of time here. At any point, if you say, whoa, slow down, I want to hear more. But it's as simple as oxygen plus pressure. So yes, we're going into chambers. Yes, we're increasing pressure and oxygen, but at the end of the day, hyperbaric, more pressure. And then we add oxygen to have another effect. If we look at the Undersea and Hyperbaric Medical Society, a group I am a part of, they keep changing their definition. I'm like, guys, how can you change the definition? It's more pressure. However, this year they've now said that, well, it can't be low pressure hyperbarics. It used to be, the definition just 1 year ago was 1.4 atmospheres absolute or greater with oxygen. Well, now they make chambers that cost significantly less that patients are using in their homes or otherwise that can go to 1.5 atmospheres. So UHMS decided it's 2 atmospheres or higher. You know, they took away that last 50 years of research and said, no, this is where it's at. And it's really unfortunate because the insurance looks at this. And if you're trying to get insurance reimbursement, they're going to say, oh, nope, only at 2.0 or higher. I have a lot of protocols that are treated under 2.0. So it's just something I like to go over a little bit there so people realize that we have a lot of different medical groups talking about what it is, but it's just oxygen plus pressure. So we all know oxygen is by far our most important nutrient. You can live for what, a month without food, a week without water, and 6 minutes without oxygen. So which one's really important? Now, our government's also going to tell you oxygen's a drug. And I disagree and agree. I disagree because, well, I don't look at all of you as drug users. However, if we're using 100% oxygen, there's a dose-dependent relationship. Too much oxygen has negative effects. So I do like to go over that because everybody's like, why can't I sleep in my chamber? I saw that Michael Jackson had his chamber at home, he slept in it. Why can't I do that? And there are absolutely negative effects if we do that. So we'll get deep into that. So right here, right now, if we checked your oxygen saturation, we put your finger in one of those little pulse oximeters, it would say 95, 97, 98. 98% of your red blood cells are carrying as much oxygen as they can. And we can't really increase that. I give you 100% oxygen, we take it up to 100, take it up 2%. It's very minimal change. Hyperbaric oxygen therapy does not focus on your oxygen saturation. It actually works by dissolving oxygen into the liquid component of your body, your plasma. And everybody here, even the little kids running around, know that we are mostly water. Our body is 70 to 80% water. Our cells are 90% plus water. So if we can increase oxygen in those places, that's where we're going to see the biggest change. I don't care if my red blood cells are carrying 95 to 98. I want that 1200% increase that we can provide with hyperbaric. So how does that work? Well, let's get a little bit into the physics of it. We're going to talk about gas laws. Henry's gas law is the same gas law that we use to make soda. You take a gas, you force it into a liquid with pressure. Well, if it's soda, it's CO2. However, you might go get a nitro coffee or a nitro cold brew, and that's nitrogen dissolved into your beer or into your coffee. It's significantly different, noticing that nitrogen doesn't feel like it's a lot of bubbles. You drink a nitro drink, it's very light. Well, you can do the same thing with oxygen. In fact, we've done it in our facilities. Dissolved oxygen into a beverage to drink. It has to take the water all the way down to the point of freezing and the pressure much higher. However, it's the same concept, dissolving a gas into a liquid and then by extension into every tissue in our body. So with Henry's gas law, if we look at, here's an example showing 100 milliliters of whole blood. This picture shows your plasma sitting on top of your red blood cells, and at room air, right here, right now, 20% oxygen, you have about 19 milliliters of oxygen per 100 milliliters of blood in your body. If I give you 100% oxygen sitting right here, I take you up to 20 milliliters. It's a very small change. If I put you into a chamber at the highest pressures we can treat at, your red blood cells will never carry more than 20 milliliters of oxygen. It cannot be increased. Now you might say, wait, hold on, Lance Armstrong, he increased it. Athletes that go treat at high altitude. If you have more red blood cells, you're going to carry more oxygen. It's a very small increase compared to what we talk about. So when we talk about adding pressure, we're looking at your plasma. So now that 0.32 milliliters of oxygen that's in your plasma, right here, right now, very small compared to that 19 milliliters. Well, if I give you 100% oxygen, it does increase that. I give you 100% oxygen at 3 atmospheres, it goes from 0.3 to 6.81. It's actually a 1,200% increase. So, okay, it's only 6.8 milliliters, and I had 20 milliliters with red blood cells. You have to remember, we have a huge amount of liquid in our body, much more than red blood cells. And in fact, if you go get an IV and come to me, great, you added in another 500 milliliters, another liter. That's a whole nother space that I can dissolve that oxygen into. People ask me all the time, should I get an IV before or after? Always before. You might have to urinate while you're in the chamber, which is less fun, but we have more ability with it. We keep urinals in the chambers. You know, why have to get out from what you're doing, getting healed just because you have to go to the bathroom? So that's that 1,200% increase, and that's at the highest pressures we treat at. We typically don't treat at the highest pressures. Just because you can get more doesn't mean that more is always better, because as we talk about what we can do, we have to look at what happens at different pressures. But I love this study. Dr. Ito Boromea in 1958, I believe, decided he wanted to see what would happen if you took out all the blood from an animal. He used pigs. He took out every bit of the blood and replaced it with saline solution and some electrolytes, put them in a chamber at 3 atmospheres, and they lived. They ate, slept, drank, did everything they could, and then after 45 minutes in the chamber, they reintroduced their blood, brought them out of the chamber, and they continued to live. He was able to prove that at 3 atmospheres, you are able to have enough oxygen to support all your tissue at rest. So it's a fantastic study. I wish we had more people doing stuff like this. So I said you don't need blood? Okay, well maybe you do need blood. But if you lived in a hyperbaric chamber at 3 atmospheres with 100% oxygen, maybe you wouldn't need blood. That's not what we're here to talk about. We're here to talk about what we can do to promote our longevity with hyperbaric. And it's interesting because we need to talk about pressure now. The pressure matters more than anything else. You might be talking about going to a center that uses, I don't know, 95% oxygen versus 100. And you might see marketing, maybe even the marketing from our website saying 100% oxygen. Guys, there's no studies that show that 98% oxygen at pressure, 95%, 90%, it's all going to have a benefit, but it's all about that pressure. So you're going to see some of the lowest pressures we treat at, 1.3 atmospheres, like going like 10 feet underwater, not much pressure, all the way up to 3 atmospheres is about 66 feet underwater, which is significant. You got to remember, at 3 atmospheres, that's about 20 times the pressure of a blood pressure cuff on your arm at its maximum. Every once in a while, you get your blood pressure checked, and you're like, ooh, I got a little tight. I'm talking about going to 20 times that pressure. Are you going to feel that everywhere in your body? No. You don't feel it because you're made of liquid, and liquid doesn't compress. So there are proven benefits at every pressure. We need to determine what you're trying to treat. We're going to be talking about longevity, so we're going to be talking about 2 atmospheres quite a bit here. However, if you're coming to me and you've had a traumatic brain injury, somebody's had a stroke, or otherwise, we use less pressure. Our brain has this fantastic ability to regenerate. This is new research. You were always told that our neurons couldn't regenerate. And I'm like, gosh, there was one cell in our entire body that can't, and everything else does? That just seems like a poor design. Our most important cells. So we found out that wasn't true. We have seen regeneration of these tissues. We see it at low pressure. Maybe we have something that the nerve leading to a tissue is not working, and now we need even more pressure. So we might be going up to 2.5, 2.8 atmospheres. We treat at all pressures. So looking at the different pressures, you might recognize that you see a lot of centers using bag chambers like this. That's not something we use in our centers. However, new research is showing a benefit. Now, there's very little research on this. In 2023, we did find that you can have a 2 to 3-fold increase in your circulating stem cells at 1.3 atmospheres using hyperbaric air. Didn't even add extra oxygen. It's fantastic research. I can't wait for it to be reproduced. So I can't wait to see more of that. And if anybody wants the studies, we provide every bit of what we're talking about here. So definitely lower cost treatment to do this. However, a little bit harder to get in these chambers. That's why we don't use them. Found that most people just didn't enjoy it, and I can treat at this pressure in a hard shell chamber. So when you see the chambers that we use, this is a picture of chambers in our facility. 1.5 to 2 atmospheres is probably the most common treatment pressures. And there's a lot of protective aspect of this with much less risk. And we'll get into risks. So there's an 800% increase in circulating stem cells at 2 atmospheres absolute if you do consecutive treatments. You cannot come and do one treatment. It's like going to the gym. You go to the gym, do one workout and leave, you're like, no six-pack? No, it doesn't happen in one workout. It doesn't happen in one treatment. In fact, most of our patients are not like yourself. They're not healthy individuals. They've done decades of damage to their body and come to us and are like, what, I need to do 5, 6, 20 treatments? I'm like, yeah, 20 days versus the 20 years of damage you did? I think we're doing a pretty good job. So the increase in the length of the telomeres, we've seen up to a 38% increase in published data. In our facilities, closer to about a 20% increase in that length. The gentleman who's the president of our board spent 100 days at pressure. He was actually underwater. He got a world record for that. He also has a little bit of an odd thing going on with his eye now after 100 days. And there's things we talk about with that, but he saw about a 20% increase in the length of his telomeres. His biological age is younger. So that's what we're talking about here at one level. Because your DNA being protected and having younger DNA is one part, but do I feel my DNA being younger? Do I get out of the chamber like, oh, yeah, I'm 29 now, I feel great. It's not like that. We're going to be talking more about the inflammation side that we're treating because inflammation is aging. And more we're talking about that. Now, there are treatment levels above 2 atmospheres, above 2.5, up to 3.0. These tend to be the ones that insurance pay for. Some of the ones that are very serious indications, they're all listed here. Yes, we treat these in our facilities. However, these are not the patients typically come to us for anti-aging. Typically, you know, something can always happen for our patients that are trying to. It's that second slide, just in case you need to see it again. So when we increase the pressure, we increase something called your driving force. So right here, right now, your oxygen exchange with the CO2 that you're breathing off, that's based off of 95 millimeters of mercury inside your lungs, pushing oxygen into that blood vessel with the exchange. Well, in hyperbaric, that goes up to 2,183 millimeters of mercury. We're not waiting for some passive diffusion. We're forcing it. It's a driving force. Why is this so important? It's all about microcirculation. Our blood vessels change as we age. In healthy aging, our blood vessels change. And you might say, great, my cholesterol hasn't been a concern. I don't get so concerned about cholesterol overall, but maybe we didn't build up all that plaque, but we built up calcium. Calcium builds up in our blood vessels, and it stops them from being able to dilate as much, makes it a little bit harder for them to constrict. So now we don't have the same amount of blood flow or the change in blood flow that we'd be looking for. Hyperbaric doesn't rely on those blood vessels. I force that oxygen directly into that tissue without that. So if we have somebody that comes to us and says, yeah, my toes are starting to go a little numb, I've had some changes there, and we look at their blood sugars, and we've addressed all that, everything's looking good. They get into the chamber, we see a change very quickly with peripheral neuropathy like this. So it's all about that driving force, forcing it in. So driving force is something we might use if somebody has a clot blocking blood flow. Here in Scottsdale, we see a lot of filler-induced necrosis. Somebody gets their lips filled up, their cheeks. All of a sudden, you put that filler in a blood vessel and there's no blood flow. They come to us all the time. And these are the same people who tell me they're doing anti-aging. I'm like, doing the exact opposite. You're putting poison in and your body has a hard time breaking it down, and now tissue is dying because of it. So we do see a lot of this, and we try to convert our patients here to understand the importance of actual anti-aging. Now, this slide is on pharmacokinetics, what a drug does to our body, and a little bit of pharmacodynamics, what our body does to a drug. Remember, oxygen's a drug according to our government, and so as we look at that, we do have to understand what those effects are. Dr. Kenwall, who gave us this quote here, is well published in our industry. I think his first book in hyperbaric medicine was in '72, so he's been around a long time doing this, and he does get onto the anti-aging side, even though he is part of the medical hyperbaric side that historically didn't really look at what we were doing as real medicine. So we've converted him. So as we talk about the pharmacological effects, I think it's very important to understand, don't take my word for it that hyperbaric works by doing this, that, or the other. Here's the actual steps. The first thing is growth factors, growth hormones. We grow brand new blood vessels. This is fantastic. We can grow brand new blood vessels in as little as 3 treatments, see an increased measurable blood flow change in as little as 5 treatments. The next one is platelet-derived growth factors. Has anybody here ever done PRP, platelet-rich plasma? Why did we do that? We took out our blood, we spun it down to get more platelets in our plasma. Hyperbaric oxygen therapy can increase that same growth factor 3.5-fold. Well, PRP is measured somewhere between 3.5 and 7.5 times increase. We're hitting almost that same numbers just by getting into the chamber. I do believe there's a time and place for injecting PRP. Come to us first. Increase the growth factor. Now when you pull that blood out, there's quite a bit more to put back in. Fibroblast growth factor. Fibroblasts are collagen. Now, we're not going to come out and everything's looking tighter or otherwise like that. Collagen is important for every tissue in our entire body. We use it to heal wounds. It creates that mesh, that matrix, but it's important for your blood vessels as well. So very important we get into that. The next one that we're really going to focus on is HIF-1 alpha, hypoxia-inducing factor. This was the Nobel Prize in Medicine. I'm going to skip past these because I really want to get to that, but don't worry, we'll talk about those. But this is a Nobel Prize in Medicine in 2019. This is the #1 reason you're seeing more hyperbaric centers open up now than you ever have. Up until 2019, we understood there was a benefit. We didn't have enough research and understanding, and now we do. And so this transcription factor regulates over 800 separate genes. We're just starting to understand it. So it's called hypoxia-inducing factor. In the chamber, you're becoming hyperoxic. It's the exact opposite. But when you get out of the chamber, your body says, I enjoyed that environment. 100% oxygen under pressure, and I get out and I have a relative hypoxia. So very important that we recognize that there's a lot of benefit getting out of the chamber. That's why we don't live in our chamber. We used to think it was 80% of the benefit was in the chamber, maybe 20% was getting out. But now I think it's probably about 50-50. 50% is getting all the nutrients while we can force into the tissue, and the other 50% is your body's response, your genetic response and that cascade. Now, this picture is something that I love. This is from a study in 2021, giving us the majority of the mechanisms. As we talk about inflammation, it is very important to recognize that we recognize exactly which interleukins. People get out of the chamber and they say, I feel less pain today. I'm like, great. We inhibited something called the COX-2 enzyme. It's on that bottom left down there. The COX-2 enzyme is the same target for ibuprofen. So next time, instead of taking an ibuprofen, take oxygen under pressure. You will have less pain. You will call me back in about 4 to 6 hours. Say, some of that pain came back. Great. Your natural ibuprofen wore off. There's so much to go over in this one picture, and we haven't even gotten to the bulk of the anti-aging. So we will move forward on this one. There's new research on the macrophage growth factors. This is a huge new area of research. I'm now the peer review editor for a journal on hyperbaric medicine, and we've got about 5 studies that have been submitted recently on this specifically. We talk about cellular senescence. It's a relatively new term in medicine. Cells that are not doing their job, and we know that we can upregulate the mitochondria, get them to do a better job, and what should that cell do is it should wake up and get out of the way so a younger cell can take over and do its job. There's a reason that we have programmed cell death, apoptosis. We can push it to that. So anti-aging, first off, I love this video. To me, this is anti-aging. To me, this is the goal, to be able to be active and enjoy. And this is what anti-aging is. This is not anti-aging, guys. This is the exact opposite. Everything we see here is pro-inflammatory. So on the anti-aging side here, we're going to talk about inflammaging. We know inflammation is a hallmark of aging. And if I can decrease inflammation, we can slow that process in every cell line. So the chronically inflamed patient looks noticeably older. You have friends that are out there drinking regularly, doing things, still maybe smoking or otherwise, that they look older. And they look older because it's a chronic level of inflammation. There's some things called inflammasomes. It's a hard word. But so these protein complexes are part of our immune system, and we see a major change in their cellular response with hyperbaric. I absolutely love to get deep into that topic. And when we talk about it, we talk about biomarkers that we measure. When people come to it and say, how do I know I'm getting the anti-aging effects? Great, we have biomarkers. We can pull these labs. For the most part, I leave that up to my patients. Say, if you wanted to look at TNF-alpha, your IL-6 and IL-1 levels, these are great markers of inflammation. Your C-reactive protein, your E-sed rate. When we see these in our patients, universally they decrease, which means less inflammation, so we know we're going to have a decrease in that biological age. Just highlighted there again, you can see those same markers for the mechanism. So these results were from a recent study, I would say 2022, from Journal of Sports Medicine. And they showed that the people in this study, the cognitive change. So on the left-hand side, you got your sham. In the lighter green, you have your HBOT group. And so cognitive change was increased. That aerobic fitness, look at energy levels. Energy levels were fantastic in the change. We see this with our patients. The next was post-training recovery. Our athletes always tell us the significant difference they've seen. And then general satisfaction. They answered a number of questions on activities of daily living, general satisfaction in their life, depression, otherwise. I love this study because it was a large number of athletes and they've all showed a benefit. Now, these are people that are going to respond better to hyperbaric than the general population. But if we talk about anti-aging with hyperbaric, these are the same things I want to talk about, cognitive enhancement. As I age, I want my brain to work better, not worse. So if we're able to see that enhancement with our patients, we know we're anti-aging in the brain. Better aerobic fitness. I am not the biggest into aerobic fitness. I do tend to like a little more of the weightlifting side. However, we know cardiovascular health is so important. What is going to be the #1 cause of death in the United States? It's cardiovascular health. If we're able to do more for our heart, we're going to have a better quality of life, better activities, more energy. I can't imagine there's a single person here that wouldn't like a little bit more energy, felt energy. Not a cup of coffee energy. It's not that same. It's not the up and down. And patients are always telling me, I don't know if I recognize I had more energy. So great. What did you get done today? Let's talk about a month ago when you came to me. You mentioned you couldn't go do these things. Maybe it was just walking to the mailbox was an issue. We see this regularly with our patients. And if I don't remind them, they're like, oh yeah, I am doing more. I do feel more. That better recovery is fantastic. And general life satisfaction, we increase a couple of different neurotransmitters, specifically serotonin. Most of our patients will tell us that they just feel better when they do hyperbaric regularly. So if we want to talk about anti-aging, we're looking at a few different things. Anti-inflammatory. We're talking about things like the DNA protection, the telomeres. Looking at our mitochondrial upregulation. Everybody knows mitochondria is the powerhouse of the cell, right? If we make more cellular energy, our body can do more. So every cellular process requires ATP. If I'm able to increase that, those processes are easier. The repair is easier. If you want to think of it kind of like currency in your bank account as your ATP, and you're like, well, at my house, I need to redo my kitchen. We do. You know, our sewer collapsed. I have to pay for that. I have to bathroom I want to change. I've always wanted this guest house. And I look at my bank account and say, we'll do one of those. What if you had 1,200% more currency in your bank account? You could tackle all those projects at once. Hyperbaric's the same general idea, 1,200% more ability. So I think it's great to see that mitochondrial upregulation. And the great part about that upregulation, guys, this is a genomic change. This doesn't change when you're done with hyperbaric. When you come to us and you stop hyperbaric, that cell line's already been upregulated. The cell turnover's happened, and now your cells are going to forever do a better job. I love that. So people ask me, like, what's the maintenance with hyperbaric? There shouldn't be a maintenance. But my patients keep coming back because most people enjoy hyperbaric. And then the stem cell side, I know everybody is excited about what stem cells, exosomes, what Dr. Yu is about to get into can do. When I went and did stem cells for my wrist, and took a little bit of fat out and put it back in, I had zero pain in this wrist in more than 10 years. I had cortisone injection after cortisone injection before that. I went to Dr. Yu and I got IV exosomes. And honestly, it was a dramatic shift. And I called him up. I'm like, all right, you're in California, I'm in Arizona. How do we continue to do this? He's like, I'll send them to you. I'll just send them to you. So we can upregulate what our body makes and then add exogenous as well. What my body makes is not going to be a concern for cancer or otherwise. Exogenous stem cells, we don't believe are going to do that. Most research shows that it won't. I still always get a little concerned about putting something else in my body that's not mine. So I always want to use my own fat. And I know Dr. Yu will get into it because he does more research on that side. I'll probably say that's not what we're talking about. So to me, this is anti-aging. Hyperbaric is anti-aging more than anything else that I can really think of. You know, it's one piece of the puzzle. I'm not going to tell you you can go out and eat Arby's and come to me and we're going to feel better. Yeah, I have a patient, this is a conversation this morning. So I can't tell you you can go do all these terrible things and hyperbaric's going to turn all of it around. Movement is medicine. The food we put in is medicine. And hyperbaric plays a major role with that. I think it gives you a good foundation for healing. So I encourage you to reach out. I encourage you to ask questions. If you scan this, it will get over to our clinics, our information. And we are doing a new program right now, and it's our Younger Next Year longevity protocol. We do it based off of 30 or 60 treatments. The published data is off 60 treatments, and I recognize it's a lot to do. And at 30 treatments, we have published data showing a benefit, but it's back to back. People that come to us, I want to do anti-aging. I can do 2 this week and 1 here and there. I'm like, guys, don't waste your time and energy. Give us 30 days in a row, you're going to see a significant difference. We're going to do telomere testing. We want to see that before and after. We want to see that on paper, but what's so much more important than what a lab tells me or a number is what you tell me. And the overall feedback on this has been amazing. The results that we've seen and the results that other centers or associations have seen, just fantastic. So if you scan this, it should give you some information on it. It should also be able to give contact information. I'm always available to answer questions. Reach out if you're looking for a center for friends, family, or otherwise. We do have a directory for everybody to reach out and find centers for them. So I appreciate you guys coming here today. And if anybody has any questions, I think we gotta get a chance to go over some of this. Thank you. Thank you. Thank you.
Thank you so much. And please, if you have any question, just raise your hand. We get the mic to you. This is the time.
Hi, Dr. Borsand. Thank you for your presentation. That was fantastic. I've been doing a lot of research on cancer and cancer prevention, and I've come across a lot of hyperbaric being used as a prevention. Can you speak about the research on that and what you've known, maybe anecdotally?
Yeah, absolutely. So we have a number of patients come in our centers treating for either adjunct therapy to cancer or to prevent cancer. Maybe they've had cancer in the past, they want to stop something from coming back. The published data has shown that for solid tumors, we've seen a 40% reduction in tumor size. It's fantastic. If you dig deeper into that research, you're going to see it was in conjunction with the metabolic approach towards cancer. If you're doing hyperbaric only, you're not stopping the fuel. So how does cancer grow? It doesn't have regulated growth like the rest of our cells. Our cells need our mitochondria to build energy. That cellular energy goes to different subcellular organelles and says, build proteins, do this. Cancer grows in the cytosol, the liquid part of the cell, and it primarily grows through the fermentation process. Well, anybody that's done fermentation knows that when you want to increase the rate of fermentation, you add sugar. So if you're eating a lot of sugar, you are going to promote cancer growth. So hyperbaric oxygen therapy is able to upregulate the mitochondria, get that cell to join its cell cycle again and get out of the way. That cell that has cancer in it will pass faster So we reduce that tumor size. Now, I do have to tell you, in our centers, when somebody comes with cancer, the first thing they hear from me is that hyperbaric oxygen therapy does not cure cancer. I do not want you to come to us for monotherapy thinking, I'm going to just get in the chamber and that's going to be everything I need, because there's too many risks associated with it. We work hand in hand with the natural centers here in town, in Vida and out in Mesa, an Oasis of Healing, Dr. Lodi, who's been in the Valley for a long time, and it's his aspect of targeting the cancer through high-dose IV vitamin C, doing the metabolic approach, and then also hyperbaric, slowing that rate and decreasing inflammation. So we've seen amazing results.
So I get, there it is. Yeah, so I think you get a pretty good nap in a hyperbaric chamber also from my own personal experience.
Yes.
But can you talk about also, because I didn't really connect this, but it seems pretty obvious that for healing from surgeries and getting over things quicker, there's just a lot of positive benefits as well, right?
Absolutely. We do so much post-surgery treatment in our facilities. Again, I mentioned we're in Scottsdale. We are one of the cosmetic surgery centers, and these are places where people want to go and have their surgery and get right back to work, whatever they're doing right away. So they're willing to pay for that aspect. We have other orthopedic surgeons, laparoscopic surgeons. People are doing other surgeries now referring to us because we're seeing somewhere between 50 and 60% accelerated recovery in surgeries like gallbladder removal. You know, if anybody's had a laparoscopic surgery, you know, what do? They fill you up with air. And you have pain across your diaphragm, probably in your left shoulder as well. One treatment, that's gone. Because we force all of that out and replace it with oxygen. We usually do about 3 to 5 treatments post-surgery. And then that time is when our patients say, wow, I recovered faster, I feel better, and then they keep coming back. So a big part of recovering from surgery is decreasing the swelling so your natural blood flow can take back over. If you're really swollen, your blood vessels are squeezing. There's a doctor locally here, Richard Jacoby, he's a podiatrist, and his book is called Sugar Crush. It was all about sugar, but also blood vessels getting squeezed. Yes, I love Jacoby, fantastic. But so if we're able to allow that swelling, to allow that blood vessel to open back up, that's a huge first step. Even one treatment will accelerate that.
Did you say that was covered by insurance in some cases, or did I mishear that?
So post-surgery, typically not. We have 15 approved indications that insurance will cover. I have to tell you, it's a fight. It's a fight, tooth and nail. I have a few patients that are getting more and more things covered. They tend to be my patients who are retired, who have the time to spend it. And the two that come to mind are both attorneys. And they are very good at getting through and just hammering them. One told me every Thursday, she calls up, what do you need from me now to get this covered? I think she's had roughly 200 treatments now covered by insurance. Off-label indication. Yeah, the squeaky wheel, right?
Well, first of all, I'm a big yes to this therapy, and I have a big sense of gratitude to you. Most of you remember that I went from 0 hearing to 25% hearing on my left side using 2.8 depth in the hyperbaric chamber. We did 1.5 sessions. At that time, I had to drive to Glendale. It was a 50-minute drive. Had to change my whole schedule around. What's interesting about this is that it took something like that happening to me for me to make that time and that money to go and do this. And I experienced such a benefit throughout my whole being. It's the only thing that gets oxygen into the brain, right?
Yeah.
So the brain is very difficult to heal. And I know, I think we have unknown things sometimes going on. So I feel for me, it gave me a lot of benefit. And I'm glad to be doing it now again in Scottsdale.
Yes.
So I just wanted to give that testimony to anyone who might be wondering about it. I think it's definitely everything you said. I was yes, it does that for me. Yes, I love going after a workout. It's I just feel fantastic. And yes, my days I just get so much done. I feel lifted. I feel uplifted. I mean, there's a lot of benefit to this. What's interesting is, it is a time commitment to get in there, and it sometimes is hard. I'm doing it as much as I can right now because I'm doing the auditory peptides.
Yes.
I am wondering if we need to look at my pressure because maybe we're doing something a little different right now. So to talk about that, but just was curious, like, because I have been told, like, and I have people who have done stem cells before were also recommended to do the oxygen chamber. What is that happens with the two of those things together? That's kind of my...
So there's a great synergistic effect here. So I spoke at the Cell Surgical Network this last year. They only do adipose-derived, take a little bit of your own fat out, spin it down, put it back in. And the study showed that if we did 20 treatments prior to that procedure, that the stem cells they put back in weren't going back to this area. So what happens is stem cells have this amazing homing mechanism to find areas of inflammation. When we radio-labeled them and put them in one knee, within 18 hours we found them in the other knee. They already are going on their own. So if we go have a procedure done where we cause inflammation, they're going to be going there. But by increasing them so much beforehand, now when you're sitting there waiting for them to reintroduce those stem cells, what we've already increased is already targeting that area of inflammation. So the accelerated recovery and accelerated growth of collagen and with that study, I don't have the numbers off the top of my head. I want to say it was probably about 12 or 15%. I can get you guys that study, even that whole presentation, because it's really interesting. It's pretty deep into the science. I was speaking to a lot of doctors who are doing those procedures. So we also right now are working with the Neil Reardon Center of Regenerative Medicine. Their residents rotate through our program, and we're regularly meeting with them about what we can do to accelerate. And we used to see 1 or 2 patients a week from them. Now we're seeing 10 patients a week because they recognize their patients are doing much better with hyperbaric.
Hi, thank you. That was really, really interesting, and I've been hearing about hyperbaric for a few years and all the positive effects for anti-aging. But personally, I've had some resistance, and maybe you can tell me if there's a connection to what I'm going to ask. Sometimes when I'm in a plane on descent, I get such pain in my ears and sinuses, mostly my ears. And so I'm thinking, oh, if I experience that on a plane, how am I going to be in a hyperbaric chamber?
It's a fantastic question because this is actually our #1 risk inside the chamber is damage to our tympanic membrane, something called middle ear barotrauma. Baro is pressure, trauma is obviously damage. And so in our centers, we do everything we can to help alleviate that. The first thing I would tell everybody is hydrate. So if you're not hydrated well, a little bit of extra mucus makes it harder for your eustachian tube in the back of your throat that connects to your ear to open up enough. Eustachian tube, you make it sounds like it's this big round open tube, but if you see it, it's closed. It doesn't look like it's open. So if people that have eustachian tube dysfunction, and my wife has gone through this, I have employees that told me they couldn't treat because of this, we have a couple tips and tricks. First, sitting upright helps dramatically. Make sure you're in a chamber you can sit all the way upright because when you lay down, all this goes backwards and you're squishing that eustachian tube more. The next step is we have a device that was cleared for hyperbaric use called an otovent. It puts a little bit of burst of air up your nose to help open up that eustachian tube, and it's very effective. My recommendation is when you go to a center, try using that before even getting into a chamber and recognize if you can feel the difference. If it bothers you regularly on an airplane, buy one of those devices for your flights. It's a dramatic difference. We do see middle ear barotrauma, however, pretty rarely. Published data says up to 3% of patients. I haven't pulled numbers in our center. However, we've had 1 perforation in an eardrum all year, and that patient got out and they're like, my ear was killing me the entire time. I'm like, why didn't you say something? We tell everybody, tell me at a 1 out of 10, not at a 10 out of 10, because we can adjust that pressure, make it work for you to get you to equalize or bring you out so we don't cause damage. There are some people that might not be able to tolerate it. If you came to our center and you couldn't tolerate treatment, we'd recognize that, we probably can't get you through it with this means. Maybe we might send you out to do more with an ENT. Yes, they can do a balloon dilation. It's quite a bit to do to get into a chamber. They even put in tubes, some I typically wouldn't recommend for the average patient. But there are approaches that can be done But if somebody can't tolerate treatment, we don't charge them for treatment either. We want somebody to be able to get the benefits, come back regularly. Somebody gets in the chamber and they're like, nope, can't do it, I'm getting out. I'm like, sorry, it didn't work out. We can always try other methods, but I'm not going to charge somebody not to get results. Yeah.
For two more questions, there's Dimitri and someone else.
Can you speak a little bit to the vision distortion that is associated with the hyperbaric chamber?
Absolutely. So there's a change in your vision. It's called, it's a temporary change. And it's a little myopia. So it's actually more about pressure than oxygen here. If you've ever gone underwater, scuba diving, snorkeling, or just spent a little bit of time at the bottom of your regular pool and you got out, you're like, oh, the vision's a little blurry for a second. It's the air gap in your lens. It's always transient. It's never been a permanent change. We usually see somewhere between 5 and 20 seconds is the most common. Your vision might get a little bit better or a little bit worse. I'm one of those people, my vision gets much better. 8K, crystal clear, ultra HD for 5 seconds. That's right back to normal. Now, on the other side of that, if you already have cataracts, we can mature them faster. Cataracts, we know that there's a function between UV light and oxygen. If you ask your doctor about what causes cataracts, we still say, I'm not sure. UV light and oxygen play a role. We're going to accelerate that. So there's two sides of that to look at. If your insurance won't pay for your cataract surgery yet, we'll get you there faster. So that's a possibility, but we've never caused cataracts in somebody that doesn't have them. It's never been published in that regard. So vision changes that you get out of the chamber with are always temporary. Audrey, do you ever have vision changes with yours?
It's so weird that you asked that question.
Sorry.
Hey, but this was like, I did it yesterday morning, so I don't know that it was related. But on the way driving here, my eyes were feeling a little weird, but I don't know if that was like a blood sugar thing I was experiencing or because I've been losing weight as well. So I'm not sure if it was connected, if it was from I did it Friday morning. So, and then today's Saturday morning. So I don't know.
It would typically be unlikely to see that. We're talking about seconds.
Yeah, but so then no.
Yeah. In published data, the longest I think ever was 5 minutes. Now, there was a published study for rats that showed with 140 treatments that they'd caused a permanent vision change. That's never been reproduced. So we do not get too concerned about that. We've been here in the Valley for 19 years at our other location. Hasn't been a concern. But on the cataract side, we always have that conversation because we don't want somebody's cataracts getting worse without them knowing that change is happening. This is our last question.
All right. Yeah, I had this treatment for 6 months. I was going to twice a week, and I felt the benefits, huge, huge benefits. The reason I stopped is because I always felt uncomfortable because I suffer from claustrophobia. So my question is, do you have today any options that you don't have to feel this claustrophobia? But I know it worked.
Yes.
I know it really works. Yeah.
So I've got two answers on that question. One, in our centers, we have chambers that are 42 inches in diameter, so you can sit upright. We light them up quite a bit, overly lit, so it feels a little bit bigger. Then once you get in, you get comfortably lower the light. And then we also have chambers that are 7'2" by 14 foot long. If you can get into an elevator, you can get into our chamber. Some of my patients can't get into an elevator. And I have to tell them that we probably can't change that for them. Claustrophobia, confinement anxiety is a hard thing to get over. I do explain to everybody, though, that we don't lock you in. There's nobody on the outside closing the door and doing that. The door opens from the inside, and it's only held shut with pressure. So our initial treatments, we go to very low pressure just to tolerate, to see how people feel. And if somebody wants out fast, I can open a door in 27 seconds. I can get you out very quickly. While we're lowering the pressure, we're talking to our patients. I would say that I can't think of a patient in this last year that didn't treat due to confinement anxiety, even though they came in having the same concern. Now, you did 60 treatments? For 6 months. I am willing to bet you made it through a lot of that confinement anxiety in that time because you kept going back. So the other part of that question I wanted to address was, you mentioned twice a week. I typically would not recommend that in your initial treatments. we create oxidation. We increase your reactive oxygen species. Oxidation ages cells. We also increase your free radical scavengers, but only if we do consecutive treatment. So we usually recommend doing a series of treatments, then time off. Somebody says, hey, I want to do 6 treatments a month. I'm like, great. Let's do Monday, Tuesday, Wednesday. Let's take off a week, and then another Monday, Tuesday, Wednesday. 3 days in a row. I really would not push somebody to do one treatment and that much time off. You're just increasing oxidation. But if you're taking your antioxidants, there's also a role with that as well. Guys, I am just, oh yes.
No, this oxidation issue. So yeah, thank you. By the way, your presentation's been great and all your, so a lot of good information. So yeah, I'd heard that about the aging thing, oxidation. So clearly you're saying that if you're doing it, if you choose to say do it once or twice a week, like Javier was saying, you're taking that risk more, or maybe you are oxidizing yourself and possibly aging yourselves.
Yeah,
Okay, you have to get. So what is that recommended?
Three treatments in a row is always.
And then you get to the point of antioxidation. So
yes, your free radical scavengers increase more than the actual free radicals themselves.
Okay.
So they're eating up those. Remember, reactive oxygen species, ROSs, they do cause damage. They also kill bacteria, fungi. They play an essential role. They're also cell messengers. All these growth factors we're talking about are a result of those reactive oxygen species, but by bringing them up and the scavengers up together. If somebody said, I want to treat once or twice a week, I would tell them I really wouldn't, but I'd also make sure they're taking enough antioxidants at that time as well.
Yeah, that was one of my concerns, of course. I've done 10 so far, as you know, and I'm going to actually do the 30 in a row.
Yes.
Yeah.
I cannot
my
wait.
telomeres first, yeah. But I want to say, so then if you are doing, to be clear on that, if you are doing, say, 3 or more one in a row, you don't have to worry about the oxidation issue.
Correct. You do not have to worry about that oxidation issue. Okay. Yeah. All right. Thank you guys so much for inviting me. It's been absolutely fantastic.